Morning, ladies and gentlemen. Thank you so much for having me here at the World Congress of Digital Health and Dermatology. My name is Kevin Fettel, and I'm a fourth-year Harvard Medical student. Today, I'll be talking about the performance of ChatGPT on dermatology board-style exams. As was mentioned, AI has rapidly advanced, impacting both medical education and clinical decision-making. Many functions in these spaces require clinical image interpretation, an area where AI's capabilities remain uncertain. AI's ability to process and generate human-like text has sparked interest in evaluating its performance, particularly in standardized testing. To answer the question of how ChatGPT does on these dermatology board questions, we produced the following search diagram. First, we used the search parameters ChatGPT and the various model numbers, as well as a combination of dermatology exam multiple choice across two databases, including PubMed and Scopus. In total, we were able to identify around 412 articles, of which we excluded 398 and kept 14 studies. Of the reports that were excluded, many were irrelevant topics or non-board question evaluation. Examples of such were board-style examination outside of dermatology, studies that asked ChatGPT to produce a differential or just evaluated common patient questions. To look at ChatGPT's overall performance by model, we first stratified on the x-axis here by model number 3, 3.5, and 4, as well as on the y-axis looked at overall performance, text-based performance, and visual-based performance. I'll note that visual-based performance was not an option until the introduction of ChatGPT 4 on the far right. As was expected, there was notable improvement with each new model. With ChatGPT 3, the overall performance was around 48% accuracy, with a slight bump in 3.5 to 57%, and with the greatest improvement with the introduction of Model 4, jumping from 57% to around 78%. But draw your attention to the far right on Model 4, and you look at the text-based performance versus the visual-based performance, you'll note that visual-based performance is still lagging quite behind that of text-based performance. So around 59 or 60% compared to 80%. We then asked the question whether the performance followed dermatological domains. And so we simply broke this down or stratified this by model number and then by various dermatological subdomains, including dermatopath, gen, pediatric, and surgical dermatology, as well as science research. And we noted a similar observation. Greatest jump happened between ChatGPT 3.5 to 4, and each subcategory we saw around a 20% improvement. For example, dermatopath was about a 45% accuracy in Chat 3.5, but jumped to about 72% with the newest model. We were also curious to know, is this improvement by model, or does this also exist within the models themselves? And so we did a linear regression model looking at textual performance accuracy over time or by access date, and noted since ChatGPT 4 introduction in March of 2023, we do see an improvement within the model. Another question we were curious about was whether the performance was dependent on the exam itself. That is to say, does it matter? Does the overall accuracy matter if it's USA, ABD style exam, or international exam? For instance, like the UK or Brazil. And we noticed no difference in the overall accuracy. Both were around 70% in these categories. So what does this mean in future directions? As was noted previously, there's no shortage of sensational headlines in the news, but two stuck out to me the most from colleagues at Beth Israel. One, on the top left here, speaks about the Association of Internal Medicine residency exam scores with patient outcomes. Briefly, this study noted that The higher the score, examination score, the better the 7-day mortality among patients. On the bottom right was a study by Dr. Rodman, also at Beth Israel, that looked at how AI chatbots defeated doctors at diagnosing illness back in November. And essentially, all he did was look at 100 standardized cases, put ChatGPT head-to-head with residents and attendings, and looked at the diagnostic accuracy. And ChatGPT was around 90%, whereas the attendings were around 75%. So put this all together, AI can be used to enhance educational outcomes, specifically exam scores, and diagnostic accuracy to improve patient outcomes overall. Thank you so much.